But we still have a problem with several bills like we have every single year where these people have this idea that the federal government should be allowed to expand it in our state, and it would be nothing but good, Dr. Mansell, because think of all the money coming our way.
Well, we've played this game before. Firstly, the most important thing is, as physicians, we think that Medicaid serves a very important part for taking care of some patients in Wyoming who have a desperate need for the support. So there are times where people accuse us of saying when we're against expansion, we're against Medicaid, and that is absolutely not the truth. But having said that, what we worry about is when we expand Medicaid, we're going to stress the system so the people who currently use it and need it won't get care. But the other problem with Medicaid is when we expand it, we see an abuse of the program from able-bodied people who just elect either not to work or manipulate the system to make themselves eligible for it. And in the long run, you have a famous free hamburger stand story that you've used in the past. When you give away hamburgers for free, everyone decides they need a hamburger, whereas if you're selling them, they have to make a decision on whether or not they want to spend money on their hamburger. And so free hamburgers generate long lines of people, and that's what we've seen with Medicaid expansion in the other states, so much so that Medicaid expansion in the other states has nearly devastated their budgets, but it's also broken their healthcare systems. So it's very common in clinics in Wyoming for us to see 2 or 3 new patients a day who are moving to our state from their state on Medicaid because they have saturated and stressed or broken that particular healthcare system.
Isn't it true?
And that's what happens when you give away stuff for free.
When you give away. And then isn't it true, though, that when you have to charge someone for your services, and you're not looking to get stinking rich off of this, but you do have a facility to run, you have nurses to pay, rent to pay, insurance that you got to pay. So when you bill Medicaid, do you get enough to cover all of that?
No, you don't. And that is the other real sad part of this, is that there are some of us who reached a point in our career where the reason we get up in the morning to go to work is we really like our job. And it's not about the income anymore. It's a fulfilling job to have, and you enjoy your job. But Medicaid doesn't pay enough for us to keep the doors open, even if we wanted to work for free. It literally does not cover the cost of providing care.
How does that affect local hospitals then?
Well, you are increasing the market share of patients who are, to use business speak, a negative margin group of people, which means they lose money every time they provide the care. And the reason that the hospitals are advocating for Medicaid expansion is because they're so desperate for revenue, because the current government paying systems don't cover the cost of the care. So it doesn't make sense that they're doubling down that they want more government-paid health care, because none of them pay enough to cover the cost of the care. So it's one of the most irrational things ever. But the reason for that is they are so starved for revenue because they are so stressed by the fact that Medicare and Medicaid aren't paying them enough. Just like a drowning swimmer, they'll grab onto anything they can, and so they're grabbing onto Medicaid expansion.
So
which is understandable, but it's not rational.
Haven't some small communities lost their local hospital because of expansion programs like this?
They have. Last year in the United States, we broke a record for the number of rural hospitals who went out of business because of this, and most of them were in Medicaid expansion states, if not all of them. Last year, 20 rural hospitals closed, and the previous record had been 17 hospitals, and these 20 hospitals were in Medicaid expansion states.
All right. Well, once again, they're trying to push it through. We'll see how far it gets this time around. I got to run. Thank you, John. Appreciate it.
Thanks, Clint.